have to know that today is a very sad day in the history of our country. And us as medical doctors, pharmacists, and the dentists of the Moraa Teaching and Referral Hospital and the other county branches in the North Rift are on strike. And we all agree?
Yes.
Yes, this follows the inability of the government to take into consideration the issues we've raised for more than 1 year now. And this includes the wanting state of health in our country, ranging from inadequate health facilities and equipment, poor staffing, poor management of health facilities, inadequate health care finances, and importantly, the fact that as doctors we don't even have a scheme of service. It has been stated that our professional is a calling. Yes, it is. But the government has used this as an excuse to exploit and oppress us as doctors. The risk involved in this profession is uncountable. Kanake can attest. They include exposure to infectious diseases, exposure to dangerous drugs, radiation, even assault from the mentally unsound patients and their relatives, among others, yet doctors receive zero risk allowance. Doctors work for long and unpredictable hours beyond the legally stipulated 40 hours a week for all civil servants, and there is no compensation for these extra hours which we work. Some have sacrificed for their families and to render these services in hardship areas only to be paid 600 shillings as a hardship allowance. Worse still, we've lost a number of doctors to treatable illnesses because they are offering services they cannot even afford to pay for. We take note that a strike is a serious national issue that deserves urgent attention, and this is the attention that we're asking the government to give and accord to this strike. However, the government has deliberately erected barriers to meaningfully having any negotiations and instead have heavily invested in using uncouth means to counter this strike. This has left us with no option other than going on strike. The issue of selectively involving the Constitution as regards the Salaries and Remuneration Commission does not favor the fact that doctors' rights have to be trampled upon. The union wishes to express its sympathies to the million of Kenyans who will miss this important service that us doctors offer. We wish to call upon all our fellow Kenyans to join the doctors in demanding for high-quality healthcare in our healthcare facilities in accordance with our Constitution. The union hopes that all efforts will be made to lift the country out of this humanitarian crisis. God bless KMPDU. God bless Kenya. Thank you.